The mystery virus started here in the city of Wuhan.
More cases were confirmed here in the U.S.
The virus is now spreading faster.
COVID-19 can be characterized as a pandemic.
Exams are off, but the stress hasn't gone away.
The president is tested positive for the coronavirus.
Global cases now nearing 50 million.
It's important to recognize both the immediate and the long-term impacts that this pandemic can have on people's mental health.
There we go. Okay.
All right. You ready?
I am ready.
Yeah. All right.
The things that I liked being in England about were being taken away from me when the lockdown measures started coming in place. So when I realized I could do my job from Cyprus, I came to Cyprus and basically started a new kind of life here.
I had this internship opportunity, and 3 months before it would have started, it just got cancelled. So that was a quite big hit.
The biggest roller coaster was more when I was laid off from work. It was because you're sort of in self-isolation, so that part was a little bit tough.
The government decision about lockdown for 2 weeks, so how are we going to be able to deliver this education? So there is only one way that we can do this, and it has to be online.
I enjoy having friends at home, so that has now stopped, and definitely it's making me a bit sad, but you know, that's the rules, and you have to reduce your personal activities and personal life to keep the entire society safe.
I would say my day-to-day life has changed very dramatically.
It is quite stressful.
Yeah.
Even thinking about it is stressful.
As seen from our survey results of 170 people, lockdown has affected most in a negative way, with only 33% saying it was positive.
Consequently, from a scale of 1 to 5, the stress levels of individuals has shown to increase significantly, with 86 people being affected a lot by the lockdown measures, although some were not as affected by this change in lifestyle. As stated by the Mental Health UK, long-term loneliness has been known to increase the risk of mental health problems such as anxiety, depression, and stress, which can prove to be very hard to manage all alone, leaving all these people at risk.
I didn't. You have to deal with some things.
I've found things that I haven't been able to do for quite a while. Started reading, going for walks, biking. We've even found like a couple of games that we used to play in the past.
So I put together a list and I thought, okay, so this virus is called COVID-19. So I'm going to come up with 19 things that I can look to and use when I'm starting to feel a bit, anxious. So we shared it on Facebook, and now there's this list of things people can do when they are feeling a bit anxious and when things are getting a bit out of hand.
You think a lot. Think how we're going to be able to get this over, and are we going to see the normal again?
So I have been keeping my social life as busy as you can, using telephone, using Viber, and other means of communication with friends and family.
I have like my friends, we can talk open about everything. I'm not alone, and they're also in difficult situations, so that helps to cope with it.
When asked how they coped, the majority said that they did not. However, many did find ways to distract themselves from the monotony, such as movies, drawing, or baking.
Even though many people have come up with ways to cope with being in isolation, 60% of people still feel that lockdown has made them more antisocial.
I've become, I guess, more athletic where I didn't have the time or had to make specific time for before.
You kind of think about every little thing that's actually good that happens in your life right now, and you appreciate it much more than before.
It's given me a great opportunity to spend more time with my wife and my children.
Now we're so ready and we're so prepared to teach online. Maybe we didn't want to explore in this area.
I have to spend more time with my family.
You have to find the light at the end of the tunnel to keep your hopes up and just have a better open outlook on life.
From these results, we can see that lockdown and quarantine led to 86% of our sample base cherishing activities that were once considered normal a lot more.
These are some positive ways in which people were affected, with many beginning to prioritize family and appreciate nature.
It affected me negatively. I can see myself how I cope with a similar situation better in the future, but it will still have negative effects then as well.
I don't feel that it has affected my mental health at all.
Initially, I would say negative, but I think ultimately it's positive.
For the first 3 months period, on a scale 1 to 5, it was like 5. Next 3 months period, 4. Right now, I think it's 2.
So I think there are very different parts of society that we need to consider, and it will be different for what part of society you're from.
Never let anything get you down. Like I said, it's a roller coaster. After the dip, it's always the woohoo.